If you have or suspect you may have a health problem, or if you require answers to specific healthcare questions or concerns, you should consult your physician or healthcare provider and not depend solely on information presented in this program.
Hello, I'm Dr. Steve Garner, and welcome to Ask the Doctor. This is our 10th season, and we are here to assist you in understanding medical issues so you can take charge of your own health. It is more important than ever to become an informed patient, and we are here to bring you timely health discussions. For those who are new to the show, there are two ways to get your questions in. One, by calling the live phone line, and two, by visiting our website at netny.net/askthedoctor. Here you can submit questions and opinions via our forum. For this episode, I have Dr. Kanchamala Kadapati, internal medicine attending at New York Methodist Hospital. Next to her is Dr. Ivan Grunberger, Chief of Department of Urology at New York Methodist Hospital. And then we have Dr. Robert Seminara, breast disease specialist at New York Methodist Hospital. And welcome to all. And it's a pleasure to see everybody. And I always get asked by people, how do you get into call Ask the Doctor? And now is the perfect time because I see that we have 4 lines free. So if you want to get those questions in, you get to the phone. Now, I always try and scan the news to bring you what's up in medicine. And fat and obesity have been in the news. We've talked about it in the past. And the first topic is you can't tell a book by its cover. And basically, it's for those people who say, you eat so much, you don't exercise, how do you do it? How do you remain so healthy and skinny? Turns out that there's a phenomenon called normal weight obesity. Now, it sounds a little bizarre. How could you be normal weight and obese? Turns out that fat can get distributed inside the body of skinny people who don't work out enough, and it can be surrounding the kidneys, all the organs inside the body. And this fat is very harmful and is a big risk factor for heart disease, strokes, diabetes, high cholesterol. So you can tell a book by its cover. And it seems that fat, we've discussed this in the past, where it's distributed makes it very different. If you happen to have a lot of fat around the hips, that's good fat. But if you have fat underneath the belly and the skin there, that's bad fat, and that's the kind that can kill you. So the key is, what kind of exercise do you do? If you just do aerobic exercise, it may not be enough. It's good to walk, to do housework and so on, but it's got to be combined with some weight training. And then again, not pumping iron, we don't expect that, but light weights that you could discuss with your doctor. You could lift a bag of potatoes or something that you feel you can handle. But it should be a part of the regular workout because this is how you increase what we call lean mass. And that helps to reduce the fat buildup inside the body. So next time you see somebody and you think, wow, this person's getting away with murder because he can eat all he wants, remains skinny, and doesn't even exercise, just remember that you get nothing free and you're really not getting away with anything because the fat is building up in areas where we can't see. One good news for our older listeners, major study was done out of Australia, and it turns out that those people who are overweight in their 60s actually lived longer than those people who are normal weight. Now, they don't know the reason why, and it's probably not a reason to go out and get bloated and so obese that you can't fit on the seat. But it is important to know that you may not be so important to go crazy over the weight, but then again, how active you are and what kind of exercise you do. Actually, one of the airlines, I think Air France, is charging 2 seats now. Did you see that? If you're obese, have you seen that? Yeah. So if you don't like the person you're sitting next to, it's you. So, you just say, okay. But anyway, I want to get to the quiz now because I know a lot of people are out there. They get the pencils and papers out. And this is the quiz for today. What is the longest word in the English dictionary with only one vowel? The longest word in the English dictionary with only one vowel. And it also has only one syllable. Okay? So this is a tough one. It's got 9 letters. Little hint, 9 letters. So get your thinking caps on out there. We want to try and get that done. And you may be the next winner of that coveted plaque, which we've now given out about 15 of them. So what we're going to do now is give you a chance to get all set up for the show. We're going to take a break. When we come back, we're going to go right to our phones. Our phone number is 718-499-6101, where you can talk about internal medicine, urology, and breast disease. Again, the number is 718-499-6101. We'll be right back. I'm Dr. Steve Garner, the host of Ask the Doctor. In addition to watching Ask the Doctor every Tuesday night at 8, You can also visit www.netny.net/askthedoctor. There you can find the topics and guests of each episode. You can read my column from the week for the tablet, and for more advice, you can watch episodes you've missed. More importantly, you can post your questions and I'll answer them on the video blog. So visit www.netny.net/askthedoctor and get your daily dose of healthy advice. Welcome back to Ask the Doctor, where our topics are internal medicine, urology, and breast disease. The number to call, 718-499-6101. I'm going to get right to our guest. I have to recognize Monsignor Bennett, who's been out there now for our 10th season, has not missed a show in 10 seasons. Monsignor, how are you? And I figured, did the groundhogs, did he see the shadow today or not? What was the story?
No.
One didn't. Oh, so it's possible. Well, the winter's good in a way because it makes you appreciate the spring, right? You need that. So which one? The New York one said spring or
No, the Pennsylvania one
okay.
said.
I think that's the real one. Yeah. So anyway, we got to meet our guests. Who is no stranger. Anybody who watches this show has seen these guests before, and you know why we had them back and why I'm excited about the show tonight. So Dr. Carapati, who's here, avid skier, right?
Well, yeah, my family, my husband is an avid skier.
Any trips planned?
Yeah, we're going to Vermont for the President's break.
So in case any robbers out there, you know she'll be gone. No, I'm kidding. So, but and I know your husband is a vascular surgeon who's been on this show.
Yes.
Dr. Engin Rao has been with us, so it's great to see you. And I know we've got a lot of great questions coming up.
Thank you.
Okay, Dr. Grimberger, it's great to have you back, and I understand you're very proud of your son. Tell us a little bit about where's he attending?
My eldest son just finished his first semester at Johns Hopkins.
Very good.
And he made the dean's list the first semester, so I'm very proud of him.
That's great. That's fantastic. And you were in Vail recently, I heard?
Yeah, I just came back from a prostate cancer conference in Vail. Did a little bit of skiing too.
Yeah, it's kind of a downer to go to the prostate cancer and then go out skiing, but I guess, you know, you guys.
I dealt with it.
It's great to have you back.
Thank you.
And Dr. Seminara, who we haven't seen in too long, and he always has such a positive message for breast cancer, for women with breast cancer. I have to mention your daughter Christine first, who's in her I couldn't believe, 4th year of medical school.
Correct.
And did she choose a specialty?
She wants to be a pediatrician.
Wow, tough work.
Tough work.
Good work.
Yeah.
So give us your upbeat thought for today on breast cancer.
Well, you know, the upbeat thought and the message is this. We've made a lot of strides with breast cancer in terms of survival with breast cancer. But unfortunately, death from breast cancer is still a number that's way too high. And we haven't done such a wonderful job in controlling that. The answer really is, when it comes to breast, overall, if you had to pick one issue that is the most paramount in breast, it is this. It is not a one-time deal. Taking care of your breast is not going to the general surgeon and removing your gallbladder. Taking care of the breast is not having a procedure done and it's over. It's not a one-time deal. The answer to not dying from breast cancer is in the follow-up. Breast cancer and caring for patients with their breast has to do with the word follow-up, and no single word is more important than that as far as I'm concerned. That is just not a one-time deal. Unfortunately, we see too much of that.
We're going to get more into this a little bit later on in the show, but we're going to see who's our first caller. Could it be Maddie? Could it be Joel? Let's see who. Hello?
Yes. Hello?
Hi, is this Jane?
Yes, it is.
Jane, you're our first caller of the night.
Really? I made it.
How did you do it?
I don't know.
Don't give
I
us-
guess I just called just in time.
Yeah, just the right timing. It's good. Tell us,
Right.
where are you calling from?
Middle Village, Queens.
Middle Village, Queens. How are things out there?
Okay, quiet.
Did you go out to eat recently any place?
I told you last time, Woodhaven House,
Woodhaven House, not too far from London Lenny's, you told me.
right across the street.
Yeah, I ate at a place called Testa.
Oh, okay.
Vesta.
You know what else is good? Georgia Diner
In Brooklyn?
on Queens Boulevard.
Oh, I guess there's several George's Diners around. Yeah, there's one in Brooklyn also. What can we do for you tonight?
Well, the reason, remember I spoke to you last week about the bloating?
Yes.
I went to the endocrinologist and they did a whole thyroid workup. They're going to do a thyroid biopsy.
Oh, interesting. They must have felt something.
No, I had 2 nodules.
Right, so they had a nodule, which is like a little bump in the neck
Right.
area.
The question is, I also had an MRI recently last night of the pituitary gland,
Right, she had some bloating, some endocrine issues and so on.
and I have a cyst on the pituitary. Could that be like affecting my thyroid?
Interesting. Dr. Karapati.
Well, it depends on the size. I mean, if it's large and it's causing pressure effect, then it might be affecting the thyroid. But if it's just a tiny cyst, it might just be an incidental finding.
It's called starts with an A, arachoid or something cyst.
Arachnoid cyst?
Yeah,
And what's the size of it?
I don't know exactly.
Okay. Yeah, I mean, if it's a tiny cyst, it may not have any impact on it.
But I have all the symptoms of thyroid, that's why.
Yeah, we tend to see
Well,
this a lot.
The
these
most
cysts.
common cause of thyroid disease is the thyroid gland itself, not from the central, meaning, the pituitary.
Jane?
Right.
So it's more than likely that you have some kind of, thyroiditis or something like that. No, you said you have a nodule. So
Right.
if you have a nodule, then the arachnoid cyst has nothing to do with it.
So Jane, you're going to give us a when is the biopsy scheduled?
This Saturday.
Beautiful. So we can get a follow-up next week?
Right.
Yeah, and they did a thyroid scan. Did they do that to see if
Yes, they did. That's how they know the nodules had gotten bigger since the last scan.
Well, it's good that you're getting in early. That's very important, and it should be very treatable.
Plus, there's a cyst also.
They'll be able to take care of it. The cyst is not even worrisome, okay?
Okay.
Be well, and we'll hear from you next week.
Have a good night.
Good night. Now we have a possible winner to the quiz. Hold your tickets out there, though. Mary Lane. Mary Lane? Somebody told me that you might have the answer to the quiz. Is that true?
Okay, I muted.
Hold on. Do you think you have the answer to the quiz?
I think I may have the
Okay,
answer.
wait, I need the drum roll. We spent a lot of money on this. Wait, you guys never heard? Can we hear the drum roll? A drum roll. But what do you think? Now, the answer was, what's the longest word in the English language with one vowel and one syllable?
Strength?
Strength is absolutely correct. I mean, how did you get that so quickly?
Well, I cheated.
Ah, no. So what's the confession here?
The internet.
Oh, internet. Is it you just typed in what's the longest word?
Yes.
But
But
that's
I'm
okay.
honest.
We never said you couldn't use the internet. That shows intelligence, right?
Okay.
So what do you have a place picked out for the plaque?
Right near the computer.
Oh, very nice. It's a prominent place where neighbors can visit. As she so can't contain her excitement, I can feel it. So Mary Lane,
Yes.
so you're all done. We're
Okay.
gonna get your name and rush that out to your freight mail.
I'll be looking forward to receiving it.
Okay. Do you have any medical issues?
No, I don't,
Beautiful.
thankfully.
So we hope.
But I enjoy the program.
Thanks. So keep watching, and you're great. It was really great.
Okay, thank you.
Take care.
Bye.
Nice to hear that excitement coming out, right? You felt it, yeah. So now we're going to go to Anna, who's on line 2. Anna?
Hi, this is Anna.
Anna, how are you?
I'm great. How are you?
Where are you calling us from?
Bed-Stuyvesant?
Oh, have you called before?
No, I've never called
First
before.
time caller. You nervous or you're okay?
I'm a little bit nervous.
Yeah, but Bedford-Stuyvesant has no restaurants, I heard. Is that true?
There's some. No, not really. I guess no.
No, I don't know why we can't do so. So at home, what's your favorite dish?
I guess probably curry chicken.
Oh, with the skin on or off?
Off.
Oh, okay, that's good. That's healthy, right? Sounds good. So I got the doctors are waiting to take your question. What's the question?
Okay, I have a question. I'm 27 and I recently lost a lot of weight. I lost probably 20 pounds in the course of like 6 months. And I don't really sleep well, and I get a lot of night sweats. And I've been to the doctor, and they've taken like the preliminary test, but they haven't really told me what's wrong. And the only other symptom I display is like my throat will swell up and then go down, and then swell up and go down. But every time I would go into the doctor, she would say, oh, it's a little red, but nothing to be worried about. And I guess I'm just concerned because I've never lost so much weight, and I just can't seem to gain any weight back.
Is your menstruation normal?
Not really. It probably comes every other month.
Okay, so we have a young girl, lost quite a lot of weight, has night sweats. We can we'll start with Dr. Seminara, and then we'll work our way around.
Were you trying to lose weight, Anna?
No, not at all.
Okay. Well, if you're not trying to lose weight and you lost 20 pounds, I think you got to speak to your doc. There's a lot of issues here. And we need to look at the simple ones first. Anxiety and how you're doing in general, and speaking to your private doctor about that is very important. And you should not be afraid to speak to your doctor about anything that you want to speak about, because your doctor is your buddy and your friend.
Thank you. Dr. Grunberger, any?
There may be some endocrinological, some hormonal issues involved, and organocological, so I think it's important to...
And Dr. Kadapani, any other thoughts?
Yeah, I just have a couple of questions for her. Are those the only two symptoms you have, the weight loss and the night sweats? Do you have any fever?
Well, no, I've probably gotten a couple of fevers in the past 6 months, but nothing terrible, like nothing.
No cough or anything like that?
No cough.
And you're basically born and brought up here in Brooklyn?
Yes, born and raised.
Okay. I mean, definitely, like Dr. Seminaro said, you'll need workup for that. I mean, some of the things, some scary things like TB and, some kinds of cancers have to be ruled out, but it might be, simple anxiety, like you said, but you need to get that evaluated.
Hannah, it's great to hear from you.
Do some routine blood work and get that evaluated. Okay?
Will you call us back?
Of course. Thank you so much. My mother watches this show every Tuesday, so she made me come over, and she said you guys would be helpful. So
this is multi-generation show. I like that.
Yes, I'm actually sitting with her now, so thank you for all of the help. I guess I'll just keep going back to the doctor and see what they say.
We'll hear from you, I hope, in a couple of weeks. Thanks, Anna.
All right, have a good night.
Take care. Very nice, right? We get bonding. Nice. It's bonding, mother and daughter bonding. Very good. Charles. Okay, Charles, where are you calling us from?
Midwood, Brooklyn.
Midwood. Do you ever go to the Caravelle restaurant?
Oh, sure, many times.
What happened? That place just closed up,
Right, somebody else took it over.
But I heard that they opened up a place in out in Queens.
Oh, well, I wouldn't go out there. That's too far.
He likes Brooklyn. All right, okay. Bell Harbor, actually. It's called Bell Harbor Steakhouse. What can we do for you tonight, Charles?
Well, I'm suffering with a prostate problem for about 20 years. And it seems as though it's getting worse all the time.
So, Charles, hold that thought. I'm going to turn to Dr. Grunberger. He'll ask you questions.
Sure.
Charles, what kind of symptoms are you having, Charles?
Charles, what kind of symptoms are you having?
Well, I've got to get up about 3 times a night to urinate, and that's about it.
And when you get up at night
to... It's getting worse all the time.
Mm-hmm.
And I've got this problem for about 20 years. I've seen about 4 or 5 urologists, and none of them have been able to help me.
Mm-hmm. Well, there are a lot of different reasons for these type of symptoms, and most likely or most commonly it is the prostate and enlargement of the prostate causes, but there are other reasons for these type of symptoms, for getting up at night. Tell me, do you have a difficult time starting the urine when you get up?
No, I don't have difficulty in starting it. Maybe sometimes, just a little.
Mm-hmm. And have you had any infections, urinary tract infections?
No infections, nothing like that. Thank God for that.
Okay. And have you tried any medications? The urologist tried any medications?
I've tried Flomax, but that wouldn't help me at all. Mm-hmm. I've tried several other things. Nothing seemed to help me.
Okay, well, most commonly prostate enlargement does cause these symptoms, and most urologists will try one of these medications like Flomax. But if it's not really improving the symptoms, there are some tests that pretty simple tests that can be done to really determine where the problem lies, because as I mentioned before, there are other causes potentially for these type of symptoms, and the problem may not be in the prostate. It may be in the bladder, the way the bladder behaves, or it could be down the stream from the prostate in the urethra, the tube that you urinate through. So if you've tried the medication and the symptoms persist, then you should see a urologist that can do some simple tests that can really determine where the problem lies.
Charles, Dr. Grunberger, if you want to see him, he's not far by, near Prospect Park Circle. So it sounds like you're not getting the treatment that you need yet, and we got to explore other avenues, second opinions, as we always say.
Yeah, that's what I think.
So anyway, I wish you luck. Give us a call back. Let us know how it's going.
So what do you want me to do about this?
Well, why don't you make an appointment with one of your urologists? You can meet Dr. Grunberger, make an appointment to see him, and maybe you can work on it together, and we'll come up with a happy ending.
Let me write that down. Bloomberger?
Grunberger, you're going to see him on the show. Just continue to watch the show, and you're going to see his number pop up. Okay? Thanks, Charles. Okay, we're going now to Doris.
Yes.
Hi, Doris. How are you?
Fine, thank you.
Where are you calling us from?
Jamaica, New York.
Jamaica, near the old Mary Immaculate, huh?
Yes.
Has anything happened to that building?
They closed that building down.
Yeah, so it's just vacant.
Yes.
Terrible. Well, what can we do for you?
Well, I wanted to ask the doctor about the celiac disease.
Can you speak up, because I can't quite hear?
I'm sorry. I wanted to ask the doctor about the celiac disease.
Celiac disease. Interesting. Yes.
Yes. I was diagnosed with celiac disease about 8 months ago. deterioration of my small intestines. And I was wondering, was there anything to prevent the deterioration of my small intestine?
Okay, Dr. Katapani, have you seen much celiac disease?
Yeah, we see it. It's the incidence is increasing, and it's one of the diseases that people don't think about right away. So, but if you keep it in mind, then it's diagnosed. So, what was your question?
What could I do to slow down the deterioration process of the small intestines? Is there any type of cure?
Right. Are you on a gluten-free diet?
No, the doctor didn't tell me. They didn't put me on any kind of medication. And the only thing he says is to stay away from wheat, barley, and rye.
Well, he's right. Basically gluten-free diet. You should avoid anything that contains those products. What he told you.
Okay, so
and that's what will relieve your symptoms. And these days, especially in New York, it's not so hard to find products without those. Like if you go to the health food stores, if you live in Brooklyn, Trader Joe, a lot of those health food stores have a lot of products for you, like gluten-free products.
But I would like to see
so that's why you got to look.
I would like to see you get out and speak to a doctor, speak to a dietitian, understand what the problem is, and then you'll be, I think, better equipped to deal with it.
You definitely need to see a nutritionist, so they'll be able to tell you what to avoid.
Okay, because I'm seeing.
Thanks a lot for the call.
Okay, thank you.
Take care. Andre's been waiting.
Thanks
Andre.
a lot for the call. Okay, thank you.
Andre's got a TV on. Andre, you got to turn the TV off. What I'm going to do, Andre, I'm going to put you on hold. I want you to turn the TV off, and then we're going to come back to you. Okay? We're now going to go to Josephine on line 2. Hi, Josephine.
Good evening, doctor. How are you doing?
How are you doing tonight?
I'm good. How are you?
Very good. Where are you calling us from?
I'm calling from New York City, Manhattan.
Oh, Upper East Side?
Yes.
I recognize the voice.
You did. I called in before, but this time I'm calling in for a friend.
Okay, that's what they all say, but we'll take it.
I have a friend. She lives in the building with me. Her name is Christine, and she had a scan test of the abdomen about a year ago. They gave her by mistake 4 bottles of an elixir sulfur drink.
Okay.
She has since then loose bowel. Now it's so bad she has loose stool every time she eats and feels nauseous.
Can you turn up the
all
sound
the
a little
time.
bit? Yeah.
She feels nauseous all the time. She feels also very weak. I heard over the news people can get cancer from these CAT scans.
I'm glad you asked this question because a lot of confusion over this. You don't want to get too many CAT scans. And as you start getting more than 5 CAT scans, it begins to give you an increased risk of cancer, but very low risk. And the benefit of getting a CAT scan when it's really needed is it far outweighs any of the risk that you're going to get. The one CAT scan that she had would not cause her any problem, any increased risk of cancer. And the drink that they give you is just a barium drink to try and see the bowel better as they're doing it. Sometimes people become a little constipated or may get diarrhea after the test. But CAT scan is a safe procedure when taken at a good place. You go to a place that's accredited where you can ask the technologist about how much dosage you're getting, as we've discussed in the past. But there's absolutely no problem. That should not be causing any of her problems.
What would you say she could do for the nauseousness and the loose stool?
Yeah, anybody have a doctor?
Yeah, well, I understand, Josephine, that her nausea and vomiting was made much worse after the CAT scan. Is that correct?
No, she's worse now, this last while.
So
she always had it up. She never had it before the CAT scan, but since the CAT scan, she has had it quite frequent.
Well, vomiting is always considered...
She's not vomiting. She's nauseous and loose bowel stool.
Okay, well, something's wrong. And we can't rest until we find the answer. And if she's nauseous and wants to vomit, then something's wrong, and she needs to go back to see her doctor, not just a radiologist, and find out what's going on. And if she doesn't get that kind of help she needs, she might have to present to an emergency department because something could be wrong. So that's important, Joe.
Josephine, one quick question. What was the reason for her getting the CAT scan? Right.
she had abdominal pain.
Same thing.
So we
Something's
all
wrong.
believe that there's something there that we haven't found yet, and we probably would like to review the CAT scan and then see, go to a good doctor, like any of the doctors up here that you could call if you have it. Where do you live? Upper
I
East-
live in
Upper-
Manhattan, but she got her test done at Lenox Hill Hospital.
Right, it's an excellent hospital. So, and that's
Right.
that's Christine.
That's correct.
So we wish Christine well. Something is wrong, and we need to get to the
By
bottom
the
of it.
way, she was 85 years old on Saturday. I think you should wish her a happy birthday.
We wish you a happy birthday.
birthday.
Happy birthday.
And
Okay.
where was
Thank you.
8 years?
85.
85
me?
years. Wow.
Yes.
Well, we wish you both well. Happy birthday to Christine. And would you call us back next week and let us know how she's doing?
Yes.
Okay.
Thank you, doctor.
Take care. Well, that was a good one. Now, we'll go to Mary, who's been waiting patiently for us. And Mary?
Yes.
Hi, where are you calling us from?
Staten Island.
Oh, very nice. You ever go to Bocelli?
Oh, yeah. No, I've never been there, but I've heard of it.
It's upstairs, I hear, but very nice Italian restaurant with music on a Saturday night, a little romance.
Yeah.
What do you think? Yeah. Where do you like to go when you eat?
Kings.
Kings.
Kings. On
King-
Victory Boulevard.
Is that anybody?
Victory
I think the
Boulevard.
doctors have heard about it over here.
Yeah, it's a
You're
good
getting
restaurant.
smiles. What's the specialty dish in there?
I like the veal parmesan.
Very nice. Maybe we'll have to try that out. We'll go.
Yeah.
So what can we do for you?
About a year ago, I had 4 spinal surgeries, and I was catheterized, and now I'm totally incontinent.
Hi.
And I was wondering if it was due to the catheterization and what can be done about it.
Dr. Grimberger, this is a sad story.
Well, the catheterization itself should not really cause permanent incontinence. You can do that temporarily, especially if you've been catheterized for a long time. The bladder can get a little bit weak, but the catheter itself should not cause you to have to lose your urine. I mean, I think that the surgery you had on the spine potentially could be related to this because the nerves that go to the bladder go through the spine, the spinal canal. Again, incontinence, leakage of urine is complicated. There's a lot of different types and a lot of different reasons for it. So I think that especially if it's going on for a long time, there are some relatively simple tests that can be done. The most important one is something called urodynamics, which is a test that checks how the bladder is functioning, and it tells us whether the bladder is contracting properly or whether it's weak, and also whether the sphincter, which is the muscle that holds the urine back, is weakened. And so this is a test that takes about 10 minutes. It's not painful, and it will give you a lot of information.
So we hope that you're going to follow that advice.
Well, would medication help at all?
Just putting you on medication may potentially make things worse. So the key here is to find out where the problem lies. And then, based on the test that I mentioned, which is very simple, you may benefit from some medication. In some situations, it's a small procedure. So really the key is to see why you are losing urine, where the problem lies, and then it can be addressed in terms of treatment.
We hope you feel better.
Thank you very much,
Give us a
Doctor.
call back. Take care. Now we have a final call before a quick break. Maria?
Yes?
Hi, Maria. How are you?
Oh, I'm not doing so well, Dr. Gardner. Good talking to you. First-time caller.
Oh, it sounds. Where are you calling us from?
I'm calling from Brooklyn. I'm right on the corner of Brooklyn and Queens. I'm on Cypress Avenue.
Oh, near the Jackie Robinson?
No, I'm much further down this way. I'm more like, you ever heard of Catania Bakery?
Sure.
Well, I live across the street from one of those bakeries.
But, you can't find too many good bakeries anymore. I was at Staten Island. Carmela's Design Excellent. Used to have Leon's in Brooklyn.
Yes.
Do you have any favorites?
Well, actually, there was a German one in Myrtle. I don't know if it's still there. Rudy's.
Rudy's.
Rudy's is still there. I think they're still the best.
Have to look for that good chocolate cake, huh?
Yes, I love chocolate.
I'm glad you sound a little up now. What can we talk about?
Well, I have a problem with my back. I just recently had a colonoscopy. I had an endoscopy because the doctor found some kind of an astringent mass around my neck area. And he decided to do a CAT scan on that. So after the CAT scan, they decided they want to do, this is what it's called. I can't even pronounce it. It's a EUS with FNA. It's like an ultrasound.
Endoscopic ultrasound.
Yes, and they put me to sleep. But the problem is, I think they pulled me up on that bed so hard that I think they pulled muscles in my the lung area. you know, the rib area.
Uh-huh.
And I've had so much pain the next day. I had this done on the 27th, and the next day I woke up with this horrible pain in my back.
Well, let's see whether the doctors can think of some relief for you.
Okay.
Dr. Kadapani.
Thank you, Dr. Garner.
Yeah, I mean, if this is just after the procedure, you know, it could be just like a pulled muscle or a strained muscle. So if you don't have any other medical problems, you know, then you could use what we call NSAIDs just for pain relief, you know, something like Motrin or Advil, if it's just this causing the pain. But, you know, it looks like there's something else going on with you that they're doing all this workup. So what did they find on the endoscopic ultrasound?
Well, I had this done the 27th. I also had an interstem removed 2 days later. I had an interstem put in my bladder because I have a bladder, overactive bladder, and nothing seemed to help, and they put this microchip in my bladder.
Mm-hmm.
After 3 months, it didn't work. I wanted it taken out. And those are the procedures I had recently, but I think another thing is when they turned me over on the table, they had to turn me on my stomach. I think that also had something to do with the pulling of the muscles.
You know, I think some people are sensitive to this pain more than others.
I think so.
Yeah, but I just was curious, the microchip, Dr. Grimberg, what is that?
Well, interstem, it's a device that's actually placed outside of the spine, and it's a device that stimulates the nerves to help control with the bladder. It's used for patients who have a severe overactive bladder that doesn't respond to medications.
So, Maria, it sounds like you got bounced around a little bit on the table.
Yes, I did.
And it's not good. We like to be gentle as possible. That, we can control the pain. The other issue, maybe you get in with Dr. Grimberger, as far as incontinence or any problems you might be having with the bladder. Okay?
Well,
But anyway, it's great to hear your voice. Great to you called. And
Thank you, but you know, they gave me something called oxycondom, whatever they call it.
They gave you something?
Yeah, but that hasn't seemed to help.
Mm.
And then he gave me some kind of a gel to rub on my back.
Oh.
And when I get up, it feels like my ribs are going to fall off with the pain.
Yeah.
Tomorrow I'm going to the emergency room because I have no choice.
You know, it's a little bit too, it's like a nuclear bomb treating it.
You didn't bump yourself or, you know, fall or anything,
No,
right?
no. It was, I went to the hospital and I was feeling fine. All of a sudden the next day this pain started. In the rib cage area between the shoulder blades, it's a constant pain. When I get up, it feels like a real numbness type of pain. I don't understand it. So my doctor prescribed that, and he also prescribed another medication, which doesn't seem to be helping too much. So tomorrow I'm just going to end up going to the emergency.
Yeah, I think it's better to get that evaluated, get an X-ray.
Sounds like you're a little depressed, too.
Yeah, I've been depressed because, you know what, I'm a very outgoing person. I love to play bingo, and I've been laying on this bed for the last 3 days with the TV in front of me.
Wow.
I'm not a couch potato.
You can ask the doctor again at 10 to 11 if you want to watch.
Yes,
okay?
I'm a big fan. It's the first time I got through, and I'm so happy that I can talk to you.
Thanks. You definitely, please get that second opinion, because there are diagnoses floating around in my head, I'm sure the doctors too, with depression and pain and so on, and we want to make sure that you get the right treatment. So be well, and give us a call back.
I'll call you back.
Thanks a lot. Well, we're going to take a short break, recharge our, our engines here. Our phone number is 718-499-6101, where you can call and talk about internal medicine, urology, and breast disease. So let's take a short break, and we'll be right back. I'm Dr. Steve Garner, the host of Ask the Doctor. In addition to watching Ask the Doctor every Tuesday night at 8, you can also visit www.netny.net/askthedoctor. There you can find the topics and guests of each episode. You can read my column from the week for the tablet, and for more advice, you can watch episodes you've missed. More importantly, you can post your questions and I'll answer them on the video blog. So visit www.netny.net/askthedoctor and get your daily dose of healthy advice. Welcome back to Ask the Doctor, where our topics are internal medicine, urology, and breast disease. With me, I have Dr. Chanchamala Kadapati, internal medicine attending, Dr. Ivan Grimberger, Chief of Urology Department, and Dr. Robert Seminara, breast disease specialist. The number to call is 718-499-6101. We're going to get right to the phones, but my guests refuse to take a break. We take a break, and they're talking about the last call. And we had one other thought, Maria. I know you're listening. And Dr. Seminara, you want to tell Maria what you thought?
Yeah, I think the panel is very happy, Maria, that you're going to go to the emergency room tomorrow because your pain is unremitting. And the reason that's important is because if you're not getting any satisfaction, the pain's not going away, you may need an x-ray of your chest, just to make sure there's nothing else that had happened to you that day. We're all trained by being good doctors and listening to our patients. So in listening to you, there's something still wrong, and we haven't yet answered the question. We can't say that it's muscular or just from lying on the table until we've ruled out everything else. So we agree it's a good idea to go to the emergency room and get that chest x-ray or an x-ray of the sort before we say it's just muscular.
Thanks, Maria. And now we're going to get to one of our favorite callers. I think it's Larry. Hello, Larry?
Yeah.
Is this Larry from Rockland County?
Yeah.
Look, this, on the computer, watches every Tuesday night to this, watches and calls in many times.
How you doing?
Larry? Hello, Larry?
Yeah.
Hi, where are you calling us from?
Flatbush.
You see? This is live television. You get fooled. I don't know where Larry is. The other Larry may have dumped us. I don't know. But we got Larry from Flatbush now.
Flatbush.
Flatbush, how are you doing?
All right.
I hear, what's going on in Flatbush?
All right, okay.
Everything's good?
Yeah.
Did you go to school in Flatbush?
Yes.
Which high school?
Tilden.
Tilden. It was always a good school. You know who went to Tilden? Al Sharpton went to Tilden. Willie Randolph went to Tilden. I didn't know that. Yeah, a lot of famous people went to. What can we do for you?
I'm calling about a hernia.
A hernia?
Hernia.
Well, we've got a surgeon here to talk to you, Dr. Seminara.
What's the problem with the hernia? How can we help you, Larry?
No, it's just that sometimes my if I lay down, my testicles go up in. If I lift a lot of weight, it comes down back and swell up.
Oh, it's the hernia. The hernia, it gets bigger, and then when you lift weights and lie down. So
no, if I lay down for sleep, it goes back up.
It goes away.
Yeah. So can you talk about hernias?
Sure. Most hernias will go away when you lie down and you're lying flat on your back. And then when you stand up, the hernia comes out. A hernia, by the way, Larry, and for our listening audience, is a word we use every day. But a hernia really means a hole. If you have a hernia, it means you have a hole somewhere in your abdomen. Through that hole, stuff is coming out. And that stuff is usually intestine or other things that are supposed to be inside. Almost all the time, these things need to be fixed. Because if they come out too far, they can get stuck there. And then that can be very serious. So you really need to see a doctor. And if you don't have one, there's a lot of clinics around the hospital or our private offices where people would be more than happy to see you.
Larry, this is something treatable, and I hope you're going to seek help.
Yeah, but I was supposed to go to the doctor, but I'm just worrying about the effects or whatever the case is it is.
Right, he's worried about the effects of the medication, so I mean of the treatment, of the surgery itself.
Right now, the surgery, if done well, which is what we expect you would have, should be very, very limited in terms of side effects. You should live a very normal and well life, and it shouldn't be a bad procedure at all.
Larry?
For me, it's a one-day surgery.
It's an ambulatory surgery. You do it and go home the same day, and then you take care of it, and you should do just swell.
Sounds like it's going to have a good ending, Larry. Be well. Thank you. Okay, now we're going to go to Francis. Hi, Francis.
Hello.
Hi, where are you calling us from?
Maspeth, Queens.
Oh, yes. We have Rosalie calls from there. Have you ever called before?
No, my girlfriend just called me and told me to call you. Oh. She told me to put the show on, and I did call, and they told me to shut the TV, which I did. Now.
Very good. What were you watching on the TV?
Ask the doctor.
Okay, that's what I like to hear. I wanted as a trick question. Okay. So tell her, what can we do to help you?
Yes, now, I was sick in 2007 with a rare blood disorder, okay? And I had a lot of treatments in the hospital, and the doctor told my daughter, let her drink lots of water because it's going to ruin her bladder if she doesn't. Well, P.S., my bladder, I'm having a lot of trouble. And here we are into 2010. And I get bladder pains and bladder infections. I've had them since I came home from rehab. And they put me on antibiotics, mostly nitrofuratonin.
Okay.
And it seems to help for a little bit, but it seems to be a chronic thing. It comes back again.
Francis, let me put you in touch with Dr. Grimberger here, and he can give his opinion as to what's going on and what you can do to get help.
Okay, thank you.
Well, one of the important factors to evaluate would be how well you're emptying your bladder, because sometimes we're not aware that we're not emptying completely. And whenever urine sits around in any place for a long time, it tends to get infected. But there's always some bacteria in the urine, and generally if we empty the bladder well, then we get rid of them and we don't get an infection. But if the urine sits around for a long time, these few bacteria can have a chance to grow, multiply, and then cause havoc. So that's one of the things that should be evaluated to see if you're emptying your bladder properly. If you are, and if you're still getting these recurrent infections, there are some strategies that we use sometimes that can be very helpful. And one of them is the drug that you've taken, nitrofurantoin or macrobid, is a good drug to use on what we call low-dose long-term prophylaxis. And basically what we do is put the patients on like a 3-month course of the antibiotic, but very low dose, only 3 pills a week. And that sometimes changes the whole environment and bladder run and solves this type of problem.
So how can, Francis, you sound a little down, and it sounds like we can get you some good help. So you got Dr. Grimberger's number flashing across the screen there? And
I don't have the TV on now.
Oh, but when you go back, I'm going to make sure they put it on for you.
Okay.
Okay? So, but please do that. Please follow up, because you can get help.
Because somebody suggested maybe it's interstitial cystitis, and I never looked into that.
Well, I mean, it's a possibility and something that the doctor would, talk to you about. If you need a referral closer to your house, give us a call. We could help you with that, too.
Okay, I'll put the TV back
And you give
on.
us a follow-up, okay?
Yes, thank you so much.
Nice to hear from you.
God bless you.
Thank you. And we have Alba. Hi, Alba.
Yes, doctor. Good evening. Thank you so much for answering the call, doctor. And I had a little issue in my right eye. Okay. It is very red. I noticed about 3:30 in the afternoon, so I called the office of my doctor, but he's not in. They told me he was going to, somebody else was going to call to give me information, but nobody called until now. And I'm concerned because in May I had a laser treatment for narrow angle.
Laser treatment in May?
Yes, laser treatment for narrow angle. They did it in March or April. Yes, and that's why I'm concerned. And it's red. Many people, they say they happen. My daughter said, don't worry, Mommy, because it happens.
And tell me, Alba, what's now the condition? Is something burning you? Is it hurting?
No, it's not burning. It's red, yes. It is red in the side of the nose, in the white side of the eye.
Okay, I understand. And this is something you don't want to play games with, because you have this treatment. You can tell what the pressure of the eye is. Very hard to tell. I know, I wish my daughter were here. She's an ophthalmologist at St. Luke's Roosevelt. But what we could do, there are hospitals that are open at night, and if you're worried about it, the New York Eye and Ear Infirmary, for example, is open all night on 14th Street. Where are you calling us from?
Yeah, I'm calling from Manhattan, for the middle town, yes.
Yeah, so I think it's a good idea. Our panel's nodding in agreement that you don't want to play games.
Yes, because I was planning, like I said, to go tomorrow morning to his office, like 8 o'clock or the earliest possible.
I would get in the cab and you go over there now and let them just check it out quickly, check what the pressure is, and let them take a look.
Okay, doctor,
Please
I will do that. You're very kind. I really, and thank you for your program. It's wonderful. You are the kindest person, in
Thanks,
a lot
Alba.
of patience.
Thanks so much.
Thank you, doctor. Thank you so much.
Thanks. Now we're going to get to Gladys. Hi, Gladys.
Hi, how are you?
Good. Where are you calling us from?
Shushay Bay, Brooklyn.
Oh, great area. What do you like out there? Because there's so many restaurants.
Not too particular about restaurants.
You're not a restaurant person?
No, I do my own cooking.
Well, what do you cook out there?
Oh, I cook all kind of stuff.
You ever cook fish? A nice
yeah,
piece?
baked foods mostly, yes. Chicken, vegetables,
delicious.
potatoes.
Do you like to stroll along the bay?
Once in a while.
Yeah, and you ever do that? Where the fish are coming in, you can get...
It looks nice, but I don't fish.
That same fish keeps coming in. I keep seeing that same fish there, but it's...
It's nice to see.
But what can we do for you?
Okay, I have a question. I was diagnosed in 2008 with stage 4 cancer.
Of the
But
breast?
before I was diagnosed, they had a colonoscopy done on me, and it was clear. There was nothing wrong there. When I got home, I had like this sharp pains and everything in the pit of my stomach when I used to eat or drink anything. So what I did was I went back for treatment, and they did some tests on me. They found a little dot somewhere in my stomach. I don't know if it was a nodule or something like that. They had to test it. they did a what did they do? They something to check it to see what was what. It came out to be positive.
Okay, so wait, I want to ask Dr. Seminara to address the issue of stage 4 colon. How old are you?
I am now. I'll be 53 this year. I'm 52.
And it was in the colon, right?
And it was in the small intestine.
Small intestine.
Small intestine.
Okay, which is.
And also, it had spread it to my ovaries, and the cancer had spread it to my omentum also. So they went in and they removed the omentum, they removed my ovaries, and they also removed a part of my small intestine.
Okay.
And
the surgery went well. Okay. I've been doing chemo. I've had chemo, about 22 sessions of chemo already for a whole year already. I do it twice a month. As of a couple of months ago, I was diagnosed as being in remission. And the doctor wanted me to do 3 more months of chemo, so I'm following up. Okay, so tomorrow I have another set of chemo to do until March, and then they want to stop it. I have this. I had 2 ports inserted. I had one in my stomach at the time for a whole year. They didn't use it. Thank God I didn't have to use it. So they did remove it last month.
The port is to give chemotherapy for those
right.
who don't know. Yes.
I have a second port in my chest. I have a second port in my chest, and that's the port that I get my chemo from. That's still in there.
Well, you really, I mean, you've been through a lot, but it sounds like you're doing the right things, and you're going to conquer this.
Yes, but my problem is right now I have pain in my, not pain, I have this pressure in my throat and my neck. It's a real tightness that I get constantly. It's like I'm locked up. If I move around, there's a lockness in my chest. And then I have to catch myself and breathe really deep to catch myself because it's like it's choking me. Is that normal?
I guess the first question I have is, with this cancer that was stage 4 of the small bowel, what type of cancer? Did they say it originated from the intestine?
He said that it was like
a lymphoma?
It was very rare. They didn't see anything like that before. It was very rare. So they found out, they diagnosed it as small intestinal cancer.
Do you remember them telling you that it was a type of a lymphoma?
No.
Well, small bowel carcinoma or small bowel cancer is quite rare, and to find it this big is just as rare. Okay, but the fact that it's a year later now and you're doing so well, and your scans show that you're pretty much disease-free is really, really very good. And long-term survival of cancers of the GI tract, wherever, with chemotherapy today, is showing a lot of promise for patients, so you're doing well.
Okay.
The only thing that I'd like to say is because you're doing so well, every little thing about you becomes super important. So, if your throat feels a little tight and you think something's going on, there's no reason to believe, your doctor should not investigate that. You've done so well to this point. I think you should bring that to your doctor's attention, and I'm sure he or she will seriously consider what's going on in your throat.
At one time, I did bring it to the attention. I had they had diagnosed, the doctor had told me they seen a small, like a little clot under my port. And they wanted to test it, so they sent me to another doctor to test it, but it came back negative. There was nothing there. But I still get these tightness in my chest, a tightness in my throat. It just don't feel right. And sometimes I have these nosebleeds. I know they might come from the medication that I'm on, from the cancer medicine, because I get a new Lester shot each time on Fridays after I get the chemo finished. And I'm figuring maybe that's something because it goes to my bone marrow and everything like that. So.
Well, you've done very well. I think you're your best ambassador. So keep bringing that to the attention of your docs, and I think you're going to continue.
Yeah, it's an inspirational story.
Very, very well. It surely is.
Thank you so much.
Thank you, doctor. Thank you so much.
Let's go to Neil now. Hi, Neil.
Hi, doctor.
Hi, where are you calling us from?
Ridgewood, Queens.
Oh, which part? Ridgewood, Queens.
Yeah.
What's out there? What's near Ridgewood?
What's near Ridgewood?
Yeah, like how do you describe it? What's famous about Ridgewood?
Well, actually, I'm originally from Brooklyn. I just moved to Ridgewood. Bamonte's, I don't know if you know the restaurant there.
Monty's Venetian Room?
No, the restaurant. Bamonte's.
Oh, Vermonte's.
Bermonte's, B.
Bermonte's, I don't know that one. In Queens?
No, it's in Brooklyn.
You know, you got me confused here, Neil. Wait, where is this?
Okay, originally I'm from Brooklyn.
Yeah.
And I just moved to Queens.
But you used to like in Brooklyn, Vermonte's.
Right.
Very good. Which neighborhood is it? And then I'll move.
Williamsburg.
Williamsburg. Okay, we got to get out there.
Okay.
Tell us about what the question is.
Okay, for the last 11, 12 years, I've seen 4 or 5 different gastroenterologists. I've endless endoscopies and colonoscopies. I went through all the medicines. This is my last resort here. I don't have acid reflux. At night, when I go to sleep, I can't sleep. Every 2-3 hours, I have to get up because I get burning and gas in my stomach. I have to get up, go to the bedroom, relieve myself with the gas and the rumblings. Then I get back to bed 2 hours later, the same scenario.
Neil, let me ask Dr. Katapani to jump on that because I want to make sure we get your answer in.
Right. I mean, so on the endoscopy, they didn't find anything? Nothing. No ulcer, no inflammation, nothing?
Nothing.
And what medications have you tried so far?
The whole gamut, Prilosec, Propulsid, Nexium.
You tried all of them?
Yes, and now the last doctor that I just saw was 4 months ago. I said this would be my last doctor. He says that maybe I had an overload of bacteria, so I took a test. And it came back that I did have an overload of bacteria.
Okay.
So he gave me medicines. It didn't work. He gave me a second test. I still had the overload. He gave me different medicines. That didn't work, so he says that's it.
So he gave you antibiotics for how long?
It was 2 weeks or whatever it was that he had to take.
Okay. Yeah, usually, no, this is for infection in the stomach or infection in the intestines?
No, it was, he gave me a test. He says for overload of bacteria in the stomach.
Yeah,
okay. Too much. So usually it's for longer. The therapy with antibiotics is longer. If they did confirm that you have it, then it's, you know, like at least 4 weeks of antibiotics.
Neil, it's for 4 weeks, but we want to continue this question because I don't want to cut you off. You could, I'd like you to either call us back next week or you can make an appointment with Dr. Katapati or one of us, and we'll get you a referral because I think you can be helped again, and I don't want to do it an injustice. So can you call us next week?
Okay, a little tough to get to you. It took me about...
You call at 5 to 8. I'm going to tell him to put you through.
What time?
5 to 8.
Next week?
Yes.
Next Tuesday, 5 to 8?
Yes.
You're going to put me through?
You're going to get right through.
Okay, I thank you.
Take care. Hope so. Anyway, John.
Yes.
How you doing?
I'm doing good.
Where are you calling us from?
I'm calling from Prospect West.
Oh, Prospect Park West.
Yes.
Beautiful neighborhood, isn't it there?
Yes.
So what can we do? I want to get right to your question.
I have a problem, a very big problem. I had a stomach that's giving me problem with a burning in my stomach and drying in my throat come right out to the tip of my tongue. The roof of my mouth is very, very dry in the night. I went to the doctor many years. They put me on the pill. They give me the thing to drink. And this doctor eventually found out 2 years ago and do the endoscopy, realized that I don't have any bacteria in the stomach. I don't have no ulcer, but I have a very inflamed stomach that he said can turn cancer.
Okay, so let's do this quickly. What about this gastritis, this inflammation of the stomach?
So basically making lifestyle modifications and dietary modifications.
I do all of that. I do everything.
You do all of that. And what about taking medications like Prilosec or Nexium? I don't know if you've tried any of those.
Nothing work. From I was a young girl, the age of 13, I had my period. I used to take the over-counter pill. He said that's it. To the age of 53, when I stopped having my period, I have terrible pain. So he said the pill, that over-counter pill over the ears, that's what messed up the stomach so bad.
John, I gotta go now because you're gonna start yelling at me because last week I went over and we had to pay extra money, you know. So we'll talk to you later, and we'll be a cliffhanger. You call next week, okay?
Okay, all right. I'll call that next week.
And remember, if you didn't have enough of this show, 10 to 11 on most of these same net stations, you can catch us tonight at 10 o'clock. And that's it for this edition. I'm sorry we left over some callers, but we'll get to you next week. I want to thank Dr. Kanchamala Katapati, Dr. Ivan Grimberger, and Dr. Robert Seminara for coming in. We hope we've been able to help you. Remember, it's good that you should be proactive about your own health. Speak to your doctors about your concerns. Go for second or third opinions, as we've said tonight. And in the meantime, continue to watch the net and visit our website. That's netny.net/askthedoctor. Here you can check out past quizzes, submit your thoughts on the forum, or watch past episodes. I want to thank you for all your calls tonight, and I'll see you again next week. So goodbye, be healthy, and I'll see you in the tablet.